Welcome back to Close Up. COVID-19 can be a scary thing, but a few thousand Granite Staters have weathered the virus and emerged with either very few symptoms or a harrowing tale of just a brutal illness. One of them is Nashua Mayor Jim Donches, who had a mild case. Mr. Mayor, thank you for joining us this morning. We're glad you are back in good health.
Well, thank you, Adam. Good to be with you.
So first of all, can you tell us, what is it like to be sick with COVID-19?
Well, of course, it depends on the individual. I was pretty fortunate. I had kind of severe flu symptoms for a few days, and then things got better. So I'm fully recovered now, and am glad, thankful that happened. But other people have been affected far more severely than I was.
Was that a sobering moment when you were first diagnosed?
Oh, a little bit, yes. I mean, what happened is I had met with someone who, after the meeting, the day after the meeting, told me that my daughter, this is the other person speaking, my daughter tested positive for COVID-19. So I said, well, we better get tested right away because you've possibly been exposed. And I didn't really think that I would be positive, but we went forward and got tested. And then the next day, the next couple of days, I did test positive.
And this was essentially just a meeting at City Hall, right? You were masked, 2 or 3 people in a room, separated, and it still got through.
Yes, it was 3 or 4 people. We might not, we tried to wear the masks, but I can't say we had them on the entire time. So there were a few meetings around that time, and I'm get them confused.
Hey, what's the lesson here in terms of how relentless and contagious this virus is?
That it can really sneak in the most unexpected ways. So the other employee, it turned out he was positive. That transferred it to me. I ended up transferring it to my wife. There were 6 people in City Hall in total who contracted the virus as a result of all this. And, we were being very careful. We didn't expect that anybody that I was talking to had been exposed at all, but we didn't know. And in the end, it snuck in.
Is the primary driver of the pandemic in the Gate City right now the proximity to and connections with Boston, or is it essentially just sort of community transmission rolling along there in Nashua?
Well, certainly, proximity to Boston creates some additional risk. The cities to the south of us, Lawrence and Lowell, have a lot more cases than Nashua. Nashua has a little more than 1,000 cumulative cases. But, we've had a couple of outbreaks. There was a situation at a downtown church where they were holding a, religious service prayer meeting, and because they wanted to be able to, of course, do the normal worshiping, they did singing without masks, and that resulted in 39 cases just in the church. And then that doesn't count any family members or anything else that may have contracted the disease. So it just, you just don't know. It can sneak in many ways. I mean, obviously, from what the medical experts tell us, public health, the weather has now increased the chances, the risks, because as the weather gets colder, we go from fall and then into winter. Coronaviruses of all types tend to do better, not better for us, but the viruses become more prominent during these colder months. And so I think to some degree this can be, this was anticipated.
How is this uptick in cases that we're seeing right now similar to or different from what happened earlier the year in the spring?
Well, it's similar to what happened in the spring. I mean, we now have over 100 active cases. It goes up and down every day, but as of Monday, I think it was 112 and has varied a little bit. I think gone up a little bit since then. It creates certainly an extra burden on our public health nurses as well as on the volunteers that are assisting them, because we're doing contact tracing, meaning that with these 112 positive patients, any one of those patients came into contact with within a short period of time before they contracted symptoms, the public health nurses and volunteers reach out to all those contacts and let them know that they were exposed, let them know that they should quarantine, and all this is designed to limit the spread of the disease. But now we have about 250 contacts that are being followed. So, in the summer at a low point, we were dealing probably with maybe 30 contacts or something like that with 20 active cases, but now obviously the numbers have gone up.
And Mr. Mayor, what's the most important thing for Nashua and the city to get done, and the people there too, as we head into this winter with potentially more cases?
We need to continue to wear our masks. We do have a mandatory mask ordinance, and anytime anybody goes into a public place, indoors, they're required by city ordinance to wear a mask. We know from the science that this really helps restrict the spread of the disease. We also need to wash our hands. We need to stay, as they say, socially distanced, apart from other people as much as we can. Avoid large gatherings outside, especially if you're standing close together. So if we continue to exercise these cautionary measures, it will limit the spread of the disease, not wipe it out entirely, of course, but will help us to limit the number of cases.
Are you worried about the months ahead?
Yeah, of course. We don't know what's coming. The winter is going to be here soon. We know that any family that's impacted by COVID-19, hopefully things will go well. But 39 people in Nashua have died as a result of COVID-19. That's 39 families that have been suffered grief and a great loss. We, of course, feel for those families and really sympathize with what they've gone through. The COVID-19 disease is difficult for those who suffer a very severe case because they may be the patient may be in the hospital, and family members may not be able to visit because of the possible contagion, the possibility of spread. So it's not anything that you want to wish on anyone.
All right, Mr. Mayor, thank you for your time, and we're glad you're doing better.
All right, thank you, Adam, and good to be with you.